Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Stephen. The COVID-19 pandemic has accelerated the use of digital healthcare, with telemedicine playing a big role in helping treat patients during the pandemic. But telemedicine appointments are just the tip of the iceberg. At Mayo Clinic, a platform revolution is underway. The Mayo Clinic Platform is a collection of initiatives focused on transforming healthcare by using technology, big data, and artificial intelligence to make connections and meet the needs of the patient. Joining us to discuss is Dr. John Halamka, president of Mayo Clinic Platform. Thanks so much for being with us today.
Well, hey, and thanks for having me.
Can you tell us what exactly is your role at Mayo Clinic?
So I joined Mayo Clinic in January of 2020 after 25 years as CIO at Harvard and Beth Israel Deaconess. Because I work in this field of medicine and technology, I'm able to link together many organizations in government, academia, and industry in novel ways. And so Platform is really about ensuring that Mayo Clinic specialty experts and technology companies, startups that are very agile and creative, and data come together to create new care delivery possibilities.
What exactly does it mean to patients?
So let me use an analogy from another area. What is Airbnb? Do they own hotel rooms? Oh no, what they are is a platform that links folks looking for a place to stay with those who have a place to stay. Well, a platform in healthcare is very similar. You may have signs and symptoms, you may have data, you may be seeking care, but we need to link you to whatever that means. Could that be outpatient consultation, an inpatient stay? Could it be an algorithm that helps with diagnosis and treatment, helping you navigate the healthcare system? So when you look at Mayo Clinic Platform, it is a variety, as you said in your introduction, of big data analytics, AI, and telemetry systems that link the customer, the patient, with the provision of the services they need.
Here's another one that hopefully you can help everybody understand. What is AI and how does that intersect?
So I have to go back to 1997. So I was a student at MIT doing computer science and engineering. I was actually the first doctor to go through that particular area of study. And AI back then was hard, really hard. What was the challenge? Is a giraffe a mammal? Well, how would you answer that question? Well, first you have to teach the computer, what's a mammal? Oh, a mammal gives birth to live young and feeds those live young and has certain physical characteristics. And so it took months to figure out how to train a computer as to what is a mammal and then ask it the big question, well, is a giraffe a mammal? Well, today, we have much more sophisticated software and approaches. Think of AI as pattern matching. What's a dog? What's a cat? Well, go upload a picture to Google and it will remarkably characterize the animal, even if it's wearing a hat or a mask or has a funny haircut, because the computer has been trained in pattern matching by looking at millions of dogs and figuring out this thing with the funny hat is actually one of those. So just think of AI as very sophisticated pattern matching using millions of training sets to then be able to predict in the future what a new thing, a dog, a giraffe, or a disease might be.
Dr. Halamka, how is Mayo Clinic leading the way in platform and partnerships to benefit patients?
So why is this a tricky business? Privacy and security are paramount, and the patient always comes first. So what you heard me say is, we can train an algorithm to recognize a dog by taking millions of dog pictures. Well, wait a minute. If we're going to be using patient data to help us understand diseases and diagnoses, how do we ensure that that's de-identified, that it's always private, that there's never going to be a situation where the data is used in a way that would be unaligned with a patient's preference? So what we had to do was create something we call the Clinical Data Analytics Platform, taking 154 years of Mayo Clinic data, some digital, some paper, some pictures, some recordings, de-identifying it, and then putting it into a secure container where we can then use AI tools to develop new knowledge based on that de-identified data. But the data itself is never seen by anyone outside Mayo Clinic.
I have to ask you how you see healthcare delivery changing in the next 5 years and then the next 10 years.
So what I often tell my students is, well, technology creates change, right? We're all carrying supercomputers. Well, think for a minute. Back in the day, I was involved in helping out with one of the earliest space shuttle launches. The entire computing of the space program had less power than this. So, okay, technology changes things. Policy changes things. Oh, because of COVID, we now actually have new laws, new regulations that enable care to be delivered at a distance. This virtual care and telehealth can be done by more people in more settings with more services than ever before. Culture has changed. Actually, during this time of COVID, we were able to get our care remotely, and it actually worked pretty well. So I tell you all that. So if you look at these next 6 quarters, right? Who knows what's going to happen 10 years from now? But the technology is very powerful. The policy, the regulations have changed to make things possible, and the cultural expectation is that we will change. So we'll be delivering high acuity care at a distance in your home, diagnostic tests in your home, measuring new kinds of telemetry in your home, and then helping you figure out what diseases you might have with the use of AI algorithms that ingest that telemetry. And all of this is going to make the care more convenient and personalized, right? So sometimes people say, oh, wait a minute, are you replacing your doctors with AI? Are you replacing that warmth and empathy with technology and devices? The answer is all of these augment the human experience. And I think you'd say, if you could get the same result and the same empathy, but do it faster and easier, that's putting the patient first. So watch these next 6 quarters. You'll see the combination of technology, policy, and culture bringing care in your home in a more sophisticated way than ever before.
Okay, now finally, I have to ask you, going off topic a little bit, tell me about your animal sanctuary, Unity Farm.
There's actually a medical history to this, believe it or not. So in December of 2011, my wife was diagnosed with stage 3A breast cancer. She's totally fine today. But she was undergoing cancer treatment, and she said, you know, I really want to make sure I give back. I really want to make sure I make a difference and I leave a legacy. And we sold our small home in Wellesley, Massachusetts, and for the same price, bought 15 acres in a little bit more rural area, Sherborne, Massachusetts. And somebody said, oh, well, you're living in a rural area. I have some roosters. You know, we can't have roosters in our town. Would you take the roosters? Sure. Somebody said, oh, you take animals. Well, we have these alpaca, and they need to be rescued. Could you take some alpaca? Oh, we've got these pigs. And before you know it, over the course of 2012 to the present, we've become the largest animal sanctuary in New England. 70 acres, 22 barns, 140 volunteers. And it all started with saving a rooster.
That's incredible. And you have all kinds of animals too, because I know you can go online and you can actually get like live cameras and check on the animals, see what they're doing at this moment.
That's true. So horses, cows, pigs, donkeys, alpaca, llamas, turkeys, ducks, geese, guinea fowl. Pretty much we have every farm animal you might imagine. And when they are abandoned, abused, diseased, they come to us. And they are here for forever, right? This is not a place where they are then passed along to others. They have forever homes. So they retire and live their lives here.
Dr. Halamka, thank you so much for joining us. Before I let you go, is there anything else that you wanted to add about the platform or anything else you want people to know?
Mayo Clinic is the most remarkable place I've ever worked. It has incredible expertise and resources, but this platform idea really is about bringing together all of the innovators around the world who want to improve healthcare and the patient experience. So I look forward for the next decade of bringing this orchestra leading facilitation that I do to bring all these stakeholders together to improve healthcare for all.
Well, our thanks to Mayo Clinic Platform President, Dr. John Halamka. Thanks so much for being on Mayo Clinic Q&A.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu. Thanks for listening, and be well.